This segment is sponsored by Mercy Health. As 2021 comes to an end, many people make resolutions for the new year, and that often includes improving their health. For women, this goal includes screenings and well visits. Doctors Andrea Buras and Margaret Whicker, gynecologic oncologists with Mercy Health, are here now to discuss why those screenings are so important. Welcome to both of you.
Thank you.
Thank you so much.
Let's talk about which screenings are recommended, at what age, and how often.
Sure. So looking at gynecologic cancers, one screening that's recommended is getting routine pap smears. So those start at age 21, and in your 20s, it's recommended every 3 years. And we also recommend HPV testing, the virus that actually causes cervical cancer, to be done with pap smears starting at age 30.
Okay. What are gynecologic cancer types?
So there's a number of different gynecologic cancers, and they're all pretty different diseases. As Dr. Buras mentioned, there's cervical cancer, but then there's also endometrial cancer or uterine cancer, cancer of the lining or the body of the uterus. And then there's ovarian cancer and some more rare cancer types like vaginal and vulvar cancer or gestational trophoblastic disease.
I know the symptoms for these cancer types are often very subtle or even non-existent. So what is it that women should look out for when paying attention to their own bodies?
Yeah, absolutely. As you mentioned, some of the symptoms can be very vague, especially for ovarian cancer. This can be symptoms such as abdominal bloating or swelling, changes in your appetite, small things like that can be signals of ovarian cancer. So important to see your doctor if you're noticing changes.
However, as we mentioned, these are different diseases, and uterine cancer, actually the biggest symptom of that is bleeding after menopause. So if a woman has gone through menopause and then begins to have vaginal bleeding again, that's not something that's normal and should be evaluated by a gynecologist.
Why is a gynecologic oncology program important for a community?
So we know that if a woman has a gynecologic cancer, the best outcomes are when she's treated by a specialist in women's cancer. And those outcomes include survival, but also things like symptom control and her quality of life, because we know that this is a life-changing diagnosis, and it's important to see someone who can really manage care all the way through the course of a woman's disease. We do surgery, we do chemotherapy. We also do a lot of things for palliative care, supportive care, things that help a woman and also her family to feel as well as possible and handle her diagnosis as she can throughout her treatment.
Oh, good. I understand you're both part of the Cancer Network of West Michigan. Can you tell me what that is?
Yeah, so the Cancer Network of West Michigan is really a partnership amongst St. Mary's in Grand Rapids, Mercy Health Muskegon, and the University of Michigan West as well. And we really are partnering together to pool resources and provide the best cancer care possible for everyone in West Michigan.
Very good. Well, for more information about gynecologic oncology at Mercy Health Lax Cancer Center or the Cancer Network of West Michigan, visit mercyhealth.com/cancer-care. And we'll put that on our website at 13onyourside.com. Thanks to both of you.
Thanks so much for having us.
Thank you so much.